For joining us for tonight's discussion. Tonight we're going to be having a conversation about Medicare for All with Whole Washington's Andre Stackhouse. So let's give Andre a round of applause. All right. Welcome, Andre. Would you mind telling us a little bit about yourself?
Yeah, sure thing. And thank you. Okay, great. And I guess you can go ahead and share the screen now as well. I've got a little presentation. It includes a bit of introduction for myself, but I would just like to start by thanking Sean for arranging this. I always love getting to speak to the community about this, and I'm really looking forward to presenting and introducing Whole Washington to you all. Um, I always like to start with an introduction to Whole Washington. So for folks who haven't heard of us, Whole Washington is a nonprofit 501c4. We were founded in 2017. We are 100% volunteer run, and that's down to every signature gatherer, all the way up to people like me, the campaign director. And if you go to wholewashington.org, our website is a wealth of knowledge. We've got an events calendar, and that's where you can see all of our meetings as well as events where we're out gathering signatures. So you can just jump right in and get involved with whatever part of the organizing sounds interesting to you. Wholewashington.org/volunteer is a sign-up page. It's really easy, and it's the easiest way to just get plugged into the campaign and get started. Also, we need donations. And so, we've run this campaign on a very small budget as far as political campaigns go. And we're able to accomplish a ton through volunteer effort. But to take on big pharma and private health insurance, we're going to need to build a huge movement, especially if we make it onto the ballot. We know that there are going to be opposition campaigns raised to the tune of $1 million, $5 million. And so, as we think about where we are today, let's always keep in mind what we're growing this movement to, something big enough to take on two of the biggest, most predatory industries in the United States today and win. Win universal health care, which has not been won before in any state or federally. We're looking to do what has never been done before, what many say is impossible. So donations help. We especially want to encourage if you can make a small recurring donation, like a monthly recurring donation. This is a way that it really helps us plan for the future and budget. And then, of course, our FAQ page, where I'll try to answer as many questions as I can today. But really, a lot of the questions that folks have are the same ones that come up all the time and are answered on our FAQ page. So maybe take a look, see if your question has already been answered. But with that, healthcare that's always there is Whole Washington's slogan. And I hope that by the end of this, we have a shared idea of what that means. But to introduce you to some of the who is Whole Washington. That's my actual email and phone number and social media at the top. So I think of one of my jobs as campaign director is to be as accessible as possible to the community, because I'm trying to get something on all of your ballots. I'm trying to create a healthcare system that's going to cover everyone who might be watching this presentation tonight. So it's really important that there's somebody available to answer community concerns and questions and help folks feel that they are able to be involved in this people-powered movement. And, just a little bit about myself. I got into politics through the Bernie Sanders campaigns. And I was a delegate at the state and national convention. And before I was doing activism full time. I worked in tech. I was a software engineer at Microsoft, and decided that there were things more important that I could be working on than, say, the Bing email platform. Um, but uh, but anyway, it's my pleasure to be the campaign director of Whole Washington, and work with fantastic organizers like Georgia, who's the founder of Whole Washington, Jen Nye, our volunteer coordinator. We've got lots of other great people in our campaign leadership. Uh, this is our board of directors, and it's got all sorts of folks on it. So Marilyn Chase, for instance, former senator, retired now. We've got disability advocates like Naomi. We've got nurses like Catherine and Mariana. And so Whole Washington is really led by a really awesome crew of healthcare justice activists. But the real essence of this campaign is the volunteers, because when we're talking about gathering signatures to put something on the ballot statewide, it's something that's really not possible unless hundreds and hundreds and thousands of people share that dream with you. So it really doesn't matter how much I believe in universal health care or how smart and famous everyone on our board of directors is. We wouldn't be talking about any of this if there weren't super hardworking organizers all across the state of Washington, some of whom are maybe sitting in the room with you or watching this presentation with you tonight. So thank you, everyone who has contributed to this campaign. And to anyone who's watching, what we're trying to build here is what I like to call a universal campaign for universal health care. And what we mean by that is anyone can be involved, and we need folks of all types. Gathering signatures, of course, is one of the biggest needs of the campaign, but we need writers, we need scientists, we need IT professionals, we need graphic designers, we need folks of all types and all talents, and whatever it is that you're great at, whatever it is that feels like your way of contributing to the campaign, we want to find that. And of course, we have an amazing grassroots movement that gets bigger every day. So we organize down to the legislative district. So you can see all of those red legislative districts are ones that we've passed resolutions in support of statewide universal health care. We also have an entire city council. We've got some of the county organizations. But then really good grassroots orgs like Physicians for Social Responsibility, Tenants Union, Transit Riders Union, Poor People's Campaign, Industrial Workers of the World, Washington State Federation for Democratic Women. So a really broad representation of everything from housing movements to transit movements, poverty movements, labor, physician organizations, and just a kind of hot scoop on some of our most recent endorsements. So Black Panther Party Tacoma has endorsed us, and they've been actually very supportive of the campaign for a long time. So we're really excited to finally make it official and announce this because they're out there all the time gathering signatures with us. But then also Steve Theringer, the representative from the 4th Legislative District, which is a big part of the Washington State Peninsula, has endorsed I-1471, which brings our total number of endorsers in the House of Representatives up to 14. Steve is also on the House Healthcare Committee. So we're really excited to build more of our support within the legislature. And, you know, we're talking about real partnerships with these organizations. So we always appreciate an endorsement and putting it on our website and, you know, sharing it at presentations like this. But we're really looking to form partnerships. So if you're a member of any community organization or a small business or a union or a faith community or what have you, please get in touch with the campaign because we would love to really discuss how we could form a real partnership and figure out how we can grow together and build this movement together. And this is just something we threw together for one of our endorsers to show our appreciation. Okay, so getting into the meat of what is universal health care. And a lot of the times when we have conversations with people out in the field, they hear universal health care and they think, oh, that's where the government is going to buy and run all the hospitals and all of the doctors are going to be government employees. And we're actually talking about a different type of universal health care. So one way that I think of it is universal public health insurance. In a textbook that would be called single payer healthcare. But the reason we call it this is because in most cases, your doctor, your hospital, they would remain private practices. What the state comes in and does is it takes care of the financing through the form of universal public health insurance. So where right now, most people get their health insurance from their employer if they are so fortunate to have it. And in this case, we would say that most people would get their insurance from the state of Washington. So in our case, it would be a healthcare plan called the Washington Health Trust. And the first sort of tenet of it is that it covers everyone. So I always say it covers you regardless of your situation. So whatever your marriage situation is, or your housing situation, or your employment situation, or your citizenship situation. These are all things that change, but everyone needs healthcare, and it doesn't matter what your situation is. So, so right now, there are about 500,000 people in Washington state who are completely uninsured. And of course, there are many times more who are underinsured. So that's why we want to create a single healthcare plan that covers everyone, regardless of how much money you make or what age you are, so that we're all getting equally high quality healthcare. Okay. So then the next part is that it covers everything. And so what we mean by this is you shouldn't need to buy a supplemental private insurance plan or pay a bunch of extra out of pocket, right? You're on this plan, which means that it covers everything. The old joke about this is that they would say that if it touches your head, they think that it doesn't count as healthcare, which is why Medicare, for instance, and many healthcare plans don't cover things like dental, hearing, vision, mental health. And of course, now we're thinking about things like reproductive health and, of course, prescription drugs. So the idea is that all of these things should be covered and there shouldn't be additional spending that needs to go into it. And then point 3, publicly funded and free at the point of use, right? So we want to get rid of the shareholders and the CEO bonuses and the stock buybacks. All of these things are huge factors in private health insurance. So we want to get rid of these things. And when we say free at the point of use, right, what we're not saying is that doctors are going to suddenly be working for free and drugs don't cost any money, right? We're saying that it's free at the point of use. So think of it like, say, the fire department. When the fire department comes and puts out your house, they don't give you a bill afterwards. And it's not because the fire department is a charity and all of those firefighters work for free. It's just that it's already been paid for, right? They don't give you an additional bill because the service has already been paid for. Okay, so how are we going to pay for it? And again, I always like to flip this around by starting with how are we not going to pay for it? Because the reality is that in the United States, the average American pays about twice as much for health care as a citizen in another industrialized country, right? A similar comparable industrialized country that has a universal healthcare system. So in the United States, we pay about twice as much, and yet we don't cover everybody. So all of this extra spending comes in the form of deductibles, premiums, copays, medical bills, out-of-network charges, price gouging on things like prescription drugs. And these are all things that we're going to stop paying. And what we're going to do instead is we're going to make the Washington state tax code more progressive. So, most of this comes down to an employer tax, and then up to 2% of that can come from employee payroll, or they can choose to cover that as a benefit. So employees may pay up to 2% as a payroll. The same 2% goes for sole proprietors, and then an 8.5% capital gains tax to make sure that investors and people who are really the highest income earners with the most money are also contributing. And so our analysis shows that 90% of Washington actually doesn't make more than 10,000 in capital gains, and the first 15,000 are exempt from all of these taxes, and also things like home sales and retirement accounts. So really, this is designed to make sure that the highest income earners are contributing a fair share to this, while everyone else can afford healthcare. And this is just a way of showing it visually. So you can see most of it comes from that employer tax. This is just a way to show the way that that employer tax is shared with the employee payroll tax. So that 2% comes out of the 10.5%, meaning that the employer could be paying as little as 8.5%. And to put this into a bit of context, the average employer spends about 12% or higher to get their employees health care, if it's something that they even provide. So for many employers, this will actually be saving them money and also saving them time, because they don't have to spend, assign personnel and spend time administering healthcare plans. They simply pay into the Washington Health Trust and know that all of their employees are covered. So what are the benefits, right? Other than what's obvious. So one thing that a lot of people might not expect is that we would actually save between $5 and $13 billion a year while achieving universal health care. So it's actually cheaper to give everyone health care. And 95% of Washington would be paying less and have more money in their pocket at the end of the year. Then it would also be more stable. So you don't need to switch insurance when your job changes. You don't have to worry about a gap when you're changing jobs in your insurance. You know that as long as you live in Washington, you have comprehensive health care. It's also more simple, so you don't have to get bills anymore. You don't have to worry about paperwork. You don't have to worry about COBRA or being kept on hold by your private health insurance company. You simply go in, get your health care, go home. And then more fair. So it's going to make the tax code more progressive, and we're going to end the practice of putting people into debt and bankruptcy for needing health care, which, by the way, medical expenses are the number one cause of bankruptcy, both in Washington state and the United States as a whole. So we could end that here in Washington. And this is a quote that really brings it all together for me. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And I think that those are perfect words to describe our healthcare system. And so for me, this quote from Dr. Martin Luther King Jr. always reminds me that we're not just talking about making a cheaper healthcare system or a more convenient healthcare system. We're talking about making a more just healthcare system and therefore a more just society. And we're continuing on in the work of so many who came before us to build a truly just society. And it's not going to be, we're not going to be done with that work until we have universal health care. These are some sort of targeted flyers that we've made. And actually, if you want to print any of our graphics or posters or anything like that, you can check them out at wholewashington.org/print. But just showing, because healthcare is something that we all need. It touches every issue, right? So universal healthcare is pro-labor because it frees the worker. It frees the worker to pursue an education or change jobs or start a business of their own, or take on their bosses and go on strike, all while knowing that they have their health care, and they don't have to worry that they're being held hostage, doing what they think is right, and maintaining the ability to see a doctor. Um, Universal healthcare is anti-poverty because it's guaranteed regardless of income, and it would cover every single homeless person, the entire houseless community in Washington State. It'd be free at the point of use, which means anyone who shows up would be covered, we wouldn't have to waste time making sure that they have a way to pay. And it would end the practice of putting people into medical debt and bankruptcy, which often is one of the first steps towards becoming in poverty, becoming homeless. And of course, universal healthcare is feminist because it covers pediatric care. It covers all of the care that is specific to the needs of having children, gives us full control of our reproductive care, and it's not tied to your spouse or employer. So it frees you to make your own choices when it comes to healthcare. Okay, so how do we actually get this work done? How do we make this the reality of Washington State? And I think that it's only fair to point out that getting this kind of work done is the job of our legislature. And we believe in getting this done with our legislature, which is why we've introduced this as legislation multiple times. So Senate Bill 5204 was introduced by Senator Bob Hasagawa. It has 7 co-sponsors in the Senate. And we actually have 14 endorsements from members of the House, although it has never been introduced in the House before. And we can talk more about the legislature. We are hoping that in the next session that we will actually be reintroducing the Washington Health Trust into both the House and the Senate to more co-sponsors than it's ever had before. But the unfortunate reality is we've introduced this into the Senate a number of times where it has always been stuck in committee. It has never been given a vote or a public hearing, which is why we're so fortunate to live in a state where we can take this directly to the people. So we filed this as an initiative to the legislature this year, which means that we've been collecting signatures and are going to continue to collect signatures through the end of the year. And if we can get enough of them, it will go on next year's ballot. And so we can put this directly on the ballot, and the voters of Washington State can vote it in or vote it down, and there won't be any vetoes or filibusters or parliamentarians, just people and votes. So we think that this is something that the people of Washington State want, and that's why we're trying to take it to the ballot. And then what happens next, right? So first thing is we got to get the signatures. Then we can win a majority vote on next year's ballot in November. And on day one, when the Washington Health Trust becomes law, all residents of Washington will be eligible to enroll. There'll be some groups of people that we can't automatically enroll. So there's a federal law called ERISA that protects certain healthcare plans from being changed. And then there's also Medicare, which is a separate program with a separate set of taxes and everything. And so we can't just move those in automatically. So we actually need to acquire certain waivers before we can move those people automatically into the Washington Health Trust. But on day one, they can choose to join if that's something that they want to do. And when we get 51% of the state covered by a public health care plan, we're actually going to transition the ACA exchanges into the Washington Health Trust. And to just put that into a little bit of extra context, about 40% of Washington State is already covered by a public health care plan. So we're not talking about going from 0 to 51. We're talking about going from 40 to 51%. And in the end, we're going to cover everyone in Washington there are going to be two major healthcare sort of services that are maintained separately. So that's the Veteran Affairs and the Indian Health Services. And those are because they have some very specific needs, both in terms of the care and in terms of the way that they are treated legally. But anything that they cannot get covered by the VA or IHS, that they could get covered by the Washington Health Trust, they actually would still be able to get covered by the Washington Health Trust. So in that way, we supplement these plans, even if we don't fully replace them. Um, so uh, I always like to bring it back to Washington State can do this. Uh, we often get sort of looked over in politics because we are not a huge state like California. We are not a swing state like Florida. Um, we are a medium sized, solidly blue state. We don't have the most electoral votes. We don't swing. And so we're often we're often underrepresented in federal politics. But that does not mean that we cannot lead. And we have led on so many issues, whether we're talking about marriage equality, whether we're talking about drug decriminalization. And these days, I'm often reminded, including on women's rights, including the right to choose, because the right to an abortion was something that was established in Washington long before Roe versus Wade and something that remains legal today. Um, and so this is another area where we believe that Washington State can lead by its example. And these are two stories that I like to tell about how healthcare systems can change. And so on the left, we have Canada, and that red province there is Saskatchewan, because that was the first province in Canada to pass Medicare. And eventually, that program was expanded to cover all of Canada. Um, and the Canadian healthcare system is a beloved Canadian institution and one of the best healthcare systems in the world. On the right, we have the United States, and that state that is highlighted is Massachusetts because the last federal reform for healthcare was the Affordable Care Act, whereas it was known before that Romney Care because it came from the state of Massachusetts. And so the point here is that the states have incredible influence over federal policy. Um, and so we think that Washington State can put a better deal on the table for the United States so that we can have healthcare justice across the entire country. These are 6 states that expanded Medicaid. So Medicaid is a program that covers low income people as well as orphans and a bunch of other groups that often have difficulty getting health care. And these are 6 states that expanded Medicaid by putting it on the ballot. With the exception of Maine, which is a touch more of an independent state, the other 5, they are red states, they are rural states, just like Saskatchewan is not a liberal province. Saskatchewan is not an urban province, and yet it was the province that began the healthcare revolution in Canada. These are 6 states that didn't have a governor that wanted to expand Medicaid, didn't have a legislature that wanted to lead by expanding healthcare to their poorest individuals. And yet their people needed the healthcare. So the point here is that this is not a red issue or a blue issue. This is something that everyone needs healthcare. And we can come together as a country on it. And we think that if we put this on the ballot, we can win. And I always like to make this slightly personal as well because I am on Medicaid. And the only reason I'm able to be on Medicaid is because I live in Washington, which is a state that chose to expand it. And so when I was at Microsoft, I had very high quality health insurance, but I was working for a big tech company. And when I decided that it was more important to work on making a just healthcare system in the United States, one of the things that I gave up was that healthcare plan. But because Washington is a state that has expanded Medicaid, I'm actually able to do this work full time and know that I have good health care. And so the moral of this story is that expanding healthcare a little bit gives us the strength to expand it further. We are at our best when we have healthcare. And so this movement is critical because it will make us stronger as a movement, as a justice movement, as a civil rights movement. It will give us greater capacity to organize and win more of our rights down the road. And so uh, let's expand healthcare here in Washington so that we can expand it all over the country and we can uh, help play a role in transforming the United States into a more just country, into a country that better lives up to its ideals. Um, and these are just some organizations getting this work done all across the country. Just so you know, this truly is a national movement. Whether we're talking about CalCare or the New York Health Act, whether we're talking about people in Maine trying to get this on the ballot, or people in Colorado who got this on the ballot in 2016 and are going to try for it again very soon. Oregon is working to get this on the ballot. So we are truly joining a movement of movements all across this country for healthcare justice. Um, and if that's something you want to be a part of, you can go to wholewashington.org/volunteer. It's not a commitment. It's just a way for us to get in touch with you and find out how you might be involved with the campaign. And you could have this form filled out before I'm done talking because it's very short. And we would love to hear from you and find out how you might get involved. If you want to sign, and you haven't had the chance to yet, wholewashington.org/sign. And you can't sign online, but we have spots all over the state where you can swing by and sign. They're also usually a place where you can grab a blank sheet if you want to ask, say, your friends and family to sign. And then when you are done with that sheet, you can usually take it right back to that same location and drop it off. So this is both a way for you to sign, but also a way for you to get signature sheets if you want to collect some. And then if you can't find a bin that's close to you and you still want to sign or you want to collect some signatures, we will mail one to you. So wholewashington.org/mail, and you can get sent one of these right to you. You can sign it. And when you're ready, you can just fold it in half, put a stamp on it, and send it back. And I don't know if this is an appropriate place to ask for an endorsement. I don't know if that's something that this group does, but we are always looking to expand our coalition. And as I said, we are really looking to make it a true partnership. So whether it's this org or you're associated with some other org and you'd like me to speak there, I'm always happy to present. I'm always happy to answer questions. And if it seems like a good fit, we would always love an endorsement. Uh, and I just thought I'd share my contact information one more time so that anyone who has any ideas for follow-ups, you want to share an idea, you want to introduce me to someone, you want to book me for a future event, whatever it is, please get in touch with me. I always love to connect with folks in the community. So thank you so much for the time today. And if I haven't droned on too much, I'm happy to answer any questions folks might have.
Andre, can you hear me? Ah, there we go. Okay, ask your question now.
I don't hear you right now.
Now we can't hear you, Andre.
He's looking discouraged.
Um,
There we go.
so
So
I wasn't able to hear a question.
Can you try speaking now?
Can you hear me now?
I can hear you. Yeah.
Cool. All right. So I was asking same things, and then I also said, so for example, like Amazon, Boeing, Microsoft. It sounds like this would save employers money. So if this gets on the ballot, do you anticipate employers just generally that pay good health insurance being against it, or in theory they should see it as an investment? Like, oh, we can save money by doing this and health, which doesn't seem likely, but I mean, if it's true that they would save money, they would just do anything to save money. So, what are your thoughts on that?
What I'll say is that traditionally, I would say that businesses have more or less favored the status quo of the current system, and um, there are, maybe a number of reasons for that. I think that, if we get this on the ballot, one of the benefits is it gives sort of that invitation to consider if maybe it's something that businesses could support, right? So it's sort of like um, I don't think businesses spend a lot of time thinking about other kinds of healthcare systems um, when they don't expect that the system might change. But when you get it on the ballot, it becomes that opportunity to say, well, let's take a look. Would we save money or would we not? Um, and one thing is that a lot of businesses have seen healthcare as a way of being a competitive employer, um, and that's actually one reason why we have that system in which 2% of the um, 2% of the business tax can be deducted from employee payroll, because some businesses actually will want to cover that as an employer benefit. Um, and so it allows for a similar sort of way for them to use healthcare as an employment benefit, but without giving them so much control over our healthcare. Um, so one thing I'll say is that a lot of those bins on that map, wholewashington.org/sign, where you can go in and sign, are businesses that are currently hosting our sheets and gathering signatures with us. And so there is a ton of support in the business community. It does tend to be smaller businesses who I think often have difficulty um, providing healthcare for their employees. Um, so I think that in terms of like starting new businesses, it can really, really help. And we have like small business exemptions and stuff like that to make sure that our healthcare plan works well for entrepreneurs and small businesses. And yeah, lots of other ways that it's beneficial to that, right? So if you want to go back to school so that you can get a business degree and start your own business, you know that you're going to have healthcare um, while you study, right? Even if you have to quit your job to get that degree. Um, so I think that I think that I think that businesses can be very supportive, and I think that by growing this campaign, and especially by getting it on the ballot, it's giving us that opportunity to build that support with businesses and get them to really consider a different kind of system where we actually make their lives a lot simpler because they don't have to expend sort of human resources on the work associated with providing healthcare, but then in many cases also saving them money and providing them a workforce that is and healthier and just more content with their healthcare system. Did folks have any other questions? No, I don't think I'm muted. I was just asking if folks have any other questions. Unless you can't hear me.
Andre, can you hear me?
I can hear you.
All right. Try again.
Yeah, I could hear.
You can hear Chris?
Okay. I was going to ask about the Medicare and how exactly that worked. Does the federal government give Washington money for covering Medicare people?
Yeah. So, if I could get it muted, just I wasn't getting that account. There we go. Yeah. So, how this works with Medicare is one of the more complicated parts of the policy and the transition plan. But basically, the way that it works is that initially Medicare is maintained as a separate service, which means that while we can't, while we're not, we can't incorporate the taxes that go into Medicare into funding the Washington plan. We also don't have to cover all of the people that are covered by Medicare, right? So it's sort of a problem that solves itself a little bit because ultimately we want the plan to cover as many people as possible because that's how you make it kind of as cost effective as it can be. So the way that it works is the way we make it optional is we actually offer it as a Medicare Advantage plan. So all the things that are not covered by Medicare, you could get by enrolling in a Medicare Advantage plan. And this is actually really important because Medicare right now is under threat of privatization through a program that was started under the Trump administration, but that has been continued under the Biden administration. And one of the key components of how Medicare has been privatized has been that it never included dental, vision, hearing, and other really important aspects of healthcare. And so folks would buy a Medicare Advantage plan to supplement their Medicare plan to cover those things that they need. The trick is that Medicare Advantage almost always means private health insurance. So basically, you get sold a private health insurance plan to get the full coverage that you need. So we would be offering a Medicare Advantage plan that's completely publicly funded and that would not require you to pay a monthly premium into it, right? So you would just enroll into it to supplement your Medicare plan, and you would be able to then get all of your care through public funds and not be paying into private health insurance. So that is without a transition, without a federal waiver, is we make it optional by offering it as a Medicare Advantage plan. Now, we can get a federal waiver, and what that basically allows us to do is, in a sense, our state would be administering Medicare. And so the federal money that goes into Medicare would be going into the Washington Health Trust, and we would be covering everyone that is covered by Medicare. And that would all be automatic. So the only way we can get this federal waiver is if we actually show that the Washington Health Trust's care meets or exceeds the coverage of Medicare, right? So if we can sort of demonstrate that our healthcare plan covers everything that Medicare covers, then we can get the federal waiver that allows us to incorporate Medicare enrollees and Medicare taxes into our healthcare plan. And so that's another reason why we actually cover more than Medicare covers, right? So we include the dental, hearing, vision, so that our plan can very clearly exceed the coverage of Medicare and make us eligible to receive those federal waivers, so that we can incorporate all of those people and all of that funding into the Washington Health Trust.
Forward to getting signatures next year.
Andre, can you hear me?
Yeah, can you repeat that?
I was just saying thanks. Looking forward to getting signatures next year.
We have a question in the chat from Carolyn. Medicare Advantage is privatized and is a really bad deal if you get very sick.
Yeah, and there have been a bunch of ways in which Medicare Advantage has been exposed as an often predatory service, and they do tricks like hosting an enrollment seminar that's up several flights of stairs, because they know, in a building that they know is not walker and wheelchair accessible, because they know that they'll get healthier enrollees and can keep out people who actually have higher medical needs, right? So that's one way in which it's been kind of exposed as even predatory at times. But yeah, we ultimately want to receive the federal waiver so that we can kind of just cleanly include everything in one plan. But our transition plan has us offering a Medicare Advantage plan, and for us, we just want it to be one that's publicly funded and doesn't have a monthly premium, so that Medicare enrollees can basically just enroll into it as easily as we can make it for them, and have all of those healthcare needs covered on basically a combination of Medicare and the Washington Health Trust, and without the need to go to any private insurer, or have any unexpected out-of-pocket expenses.
We have another question in here? Okay.
Oh, I got a question and then we got a comment. Can you hear me?
Mm-hmm.
So 2 questions. If someone volunteers to gather signatures, is there like a whole Washington training event that'll help people learn the process? And then what are the safeguards to prevent this from being defunded when it does get passed?
Mm-hmm. So, yeah, what we tend to do is we meet on Monday evenings, and we run an orientation for folks who are new. So if you can join us Monday at 7 p.m., that's when our weekly meeting is. We do also have signature gathering events, and if you attend one, usually somebody there can run a training for you. And you might also check our website for some training materials. We've got some good videos that explain basics of how to gather signatures. And you can also join us on Slack, where we have a really supportive team and an Ask Anything channel. So you can just post questions, and we have a lot of people who are really good at answering things, because there's lots of things that might come up that somebody asks you when you're out gathering signatures. And we can't anticipate all of those questions, but usually if you ask on our Slack, somebody can answer it. And what I'll say is, we try our best to provide training, and to make sure people feel that they have access to the support that they need. And really, what we try to do is get folks to join us out in the field, and gathering that first signature is the hardest one. And it can take a while to get you all the equipment and to get you feeling comfortable enough to go up to somebody and ask. But the second signature is much, much easier than the first. And so once you gather that first signature, you're going to fill that first sheet faster than you expect. And then you'll be asking us for another one. And so, yeah, I really encourage folks to go to one of those bins and get a sheet. you can be your own first signature, and you can start with just your friends and family, and join a training or join us on Slack, and then we can get you out into the field and get you going. So I see one that came in the chat, and it's a follow up on the Medicare Advantage part. Medicare Advantage is gutting Medicare funds with practices like upcoding. I don't understand why you would be promoting this. Yeah, and I'm not
What is
not as
upcoding?
familiar with. Yeah, so upcoding is something that I'm not as familiar with, and if I could get a clarification on that, I might be able to answer. It's also something that I can take back to, our legislative team and see if they have more information on how we deal with things like that. But what I would say is, we're not promoting Medicare Advantage, and it's not something that we're trying to do. It is our way of incorporating Medicare enrollees who want to be a part of the plan that we're creating. It's a way to allow them to supplement their care and opt in before we receive the federal waivers that we would need to incorporate everyone into the plan. So we want to give people ways to enroll even if we're waiting on those waivers from the federal government. And that is one way that we have found to do that. But it's not because we it's not because we're promoting Medicare Advantage, I guess is the way that I would put it.
Another question or comment?
Can you hear me?
Yeah.
Yeah. Okay. Where can I find more information on the math of this beyond what we would pay and how much the savings would be? Like, I'm just really curious about where the savings comes from. So obviously cutting out the middleman of insurance, but like, are the numbers out there in some form that I can look at in more detail?
Yeah, so there's basically two reports that I would recommend, and so one of them is a report that was made by Dr. Gerald Friedman, who's an economist from UMass Amherst, and he's run a couple analyses on the Washington Health Trust. And so in his latest one, and you can find this on our website, I think it's under information at the top of the in the header. So Dr. Friedman's analysis basically looks into this and finds a savings of $13 billion annually. And you can look at the different ways in which this occurs. One of the main ways is through reducing administrative waste. And so it takes a lot of work to administer so many different healthcare plans, both on the doctor's end and on the insurance side and on the hospital side. And so you have so many different insurers that you have to interface with that, often they maintain staff and offices just to handle insurance. And it can take even a physician a significant amount of their time. And so by standardizing folks onto a single health insurance plan that's sort of like, that they have it and that they take it. So you can just sort of focus on getting a patient into care. There's a lot less administrative work associated with that. The other is then by buying in bulk, right? And so by covering everyone in the state of Washington, it means that we can get better deals on things like drug prices, right? So it's sort of that like Costco business model. If you can buy in bulk, if you can say, if you take this insurance, you're covering everyone in Washington. That's like, I think 7.5 million people. So you know, there's ways in which you create an economy of scale and gain efficiencies out of that. And then there's things like preventative care, right? So by allowing people to go in and see a doctor, you know, and get something detected early, get it taken care of early, rather than them putting off seeing a doctor because they can't afford it, putting off care because they can't afford it, being resuscitated in the emergency room, and then finally receiving emergency care for a problem that could have cost significantly less had they gotten taken care of because they knew that they economically could afford to do that. So there's lots of different ways in which it saves money, um, and uh, and you know the main, I guess, places where I would say we see these inefficiencies, right, really are in private health insurance and in pharmaceuticals, right? So generally speaking, um, you know, we don't think of this as something where it's like hospitals need to make a lot less money or doctors need to make a lot less money, right? It really comes from eliminating administrative waste and inefficiency within private health insurance.
Andre, check your private chat there. I'm going to read the next statement while you do that. You see that? Your audio is a little janky. Ask him to refresh his browser. That might be worse.
What was your comment, Kevin? What was your comment?
Andre? Yeah, it's about the same. Let me do something on my side. In the interim, take a look at the chat here, and I'll have you respond to that in about 30 seconds. So what Carolyn says is upcoding equals when providers fraudulently claim more illnesses than they are actually being treated. So the companies get more money from Medicare funds than they are entitled to. So give me a second before you answer that.
Last month, that was the topic of our this speaking thing. We had some guy from Washington.
So what I can say about this is that, you know, reimbursement rates would be negotiated with providers. And, you know, this is the sort of thing that the implementation by the board that's formed. Sorry, is my audio any better?
Your audio is a lot better.
Okay. So I'm going to try to just answer this the best that I can. And you know, it's something that I can try to follow up on and get more information about. But basically, you know, the way that this is going to work is when we pass the Washington Health Trust, it's going to create a commission, and that commission is going to have several subcommittees that represent different constituencies, like providers, like community. So they're made up of different kinds of representatives, and they're going to negotiate things like the reimbursement rates, and you know, we need to make sure that during that process, you know, we can bring forward things like upcoding and make sure that we put measures in place that that would prevent that from being abused. Um, and uh, and so this is not something that I think like one of the reasons why I think that this is um, common within Medicare Advantage is because those are private health insurance companies which are working within a profit motive, and there's a set of incentives that incentivizes that kind of that kind of uh, fraudulent billing. And so by removing that profit incentive and by negotiating these rates in a transparent process with community input, I think that, you know, this is one of the areas in which we can do better by doing this through a public system and public funding and a public process. And by the way, uh, folks, just they also wanted to say, where can I get more information in general? Again, wholewashington.org/FAQ has a lot of these questions. And, I don't know if it's something that would be considered fun reading for everyone watching, but the initiative itself is very well written. It's gone through multiple iterations. It's had a ton of input from professionals and academics, community organizers, and it's the latest version, I-1471, is the best version that we've ever made. We were able to actually shorten it by about 20 pages. And it's more readable than you might expect. A long healthcare policy to be. So certainly something that I've learned a lot by reading it and participating in the drafting process. And if you really want to get into how it works, it's available on our website to read. And one thing I'll add is that you know we are about to introduce this into the legislature. We also might be reintroducing this next year for an initiative, depending on if we get enough signatures this year or not. But there are always opportunities to improve the legislation itself. And so if you actually have concerns about the legislation as written, I recommend reading it. But those concerns are something that we will be as responsive to as we can be, because we want to create the best healthcare plan that we can. And so if you take that time to bring concerns to us that we weren't able to think of, if you're able to run it past maybe a professional or an academic or somebody that who you think might have good insights into this, and they notice something that's worth bringing to our attention, please bring it to us. And we would absolutely love to bring that to our legislative writing committee and seeing about incorporating it into future versions, or even possibly a companion if for instance, we're unable to modify a bill that session, but we are looking to pass it. We might introduce some of these changes as a companion bill. So there are ways in which we can take action on those sorts of concerns, regardless of where things are in any of the campaigns. But yeah, I just the most I can do, other than try my best to answer the question, is give my commitment that we are trying our best to make the best healthcare plan that we possibly can. We want it to cover everyone. We want it to be completely publicly funded. We want it to eliminate waste, fraud, and abuse. And we want it to provide high quality healthcare to everyone. And if there's any way that we're ever coming up short on that, we want to hear those concerns and take whatever action that we can.
Joe, you have a question?
Hi, Joe Walter, can you hear me?
Yes.
Great. A little frustrated with the Medicare Advantage question. I think I'm just going to keep working on clarifying. I think I heard you say, Andre, that it is not, that the coverage we would provide for people who are on Medicare would be a supplement. And did you say that it would be something similar to Medicare Advantage, but it would not be a traditional Medicare Advantage plan? Am I correct?
Yeah. So this is like related to our transition plan, right? So we cannot simply move everyone who's on Medicare into the Washington Health Trust until we acquire a federal waiver. And one of the ways that we acquire that federal waiver is to show that our coverage meets or exceeds the coverage of Medicare, right? So that's a process that goes through the federal government. It's one that we can't necessarily anticipate how long it will take. And so before we acquire that federal waiver that allows us to incorporate Medicare enrollees as well as the funding from Medicare into the Washington Health Trust, before we get the waivers that allow us to do that, we want to provide a mechanism for which people who are covered by Medicare can enroll into the Washington Health Trust. And so they would be able to enroll into it as a Medicare Advantage plan, and they wouldn't have a monthly premium. All of the funding is public, right? It's not paying into private health insurance. It's not contracted through private health insurance, but it would supplement their coverage to include things that are not covered by traditional Medicare, like dental, vision, hearing, right? So if you're on Medicare and you want to have your coverage include dental, vision, hearing, you don't want to pay into private health insurance, then you can choose to enroll into the Washington Health Trust to get that coverage with no monthly premium, and with none of that money going into private health insurance.
And clarifying the question a little bit more, will it be called Medicare Advantage, or will it simply be called our supplement?
I think that I don't know what it would be called is specified in the initiative. I think that's something that would probably be worked out by the board when it's formed. But my understanding is that it's not called Medicare Advantage, right? It is simply offered alongside, other plans, right? So it's you enroll in traditional Medicare, and then you are given the option, would you like to enroll into one of these plans? And one of them would be the Washington Health Trust.
Thank you, and therefore, I think I will avoid calling our supplement, even using the word Medicare Advantage, because there are so many negative connotations right there, and I might avoid having these concerns come up when someone like Carolyn would say, what do you mean Medicare Advantage? Maybe just call it, describe what it will do without actually calling it Medicare Advantage. Another question, in collecting signatures, the first thing that comes up is money, how we're going to pay for it, and I heard and saw everything you presented. Do you have like the 30-second elevator speech about how can I reassure someone that we're not going to bankrupt anybody by doing this?
Yeah. Well, basically, what I would say is that the first thing is that the care is always free, right? So everyone is going to have the access to care regardless of what like uh, level of income they have, or if they have any income at all. So when it comes to like what you might pay as an individual, right? I mean, I guess one thing is that the price of healthcare is something that has increased significantly in the last say 20 years, right? So inflation is something that gets a lot of talk now, but really the inflation of healthcare prices in the United States is something that is completely unsustainable, right? And so that's a rising cost on businesses. It's a rising cost on consumers. You have things like the pandemic where uh, tons of people get kicked off of their health care, right? So right at the moment when you need it, because you've lost your job, is when you lose access to your health care. So there are many ways in which nobody really has true healthcare security in the United States because um, you know the costs can be so astronomically high. The coverage can be often very deceptively flawed. And so a lot of times people think that they have reasonably good healthcare coverage. They don't actually know until they're trying to use it, all of what's not covered and how much they are, on for paying, right? And so one is that, we guarantee the healthcare. You're never going to be denied care. Uh, if you look at the individual ways in which it's paid for, right? The most you're ever going to pay is a 2% payroll tax. And, if you look at your pay stub, you might notice that um, every month, you do have money withheld for things like, Medicare, Medicaid, Social Security, and then a private health insurance premium. That's money that you're already paying every month. And so um, we do have, I believe, um, actually it might not be on our website, but we've had in the past a savings estimator that gave people a really easy way to fill in their information and kind of see what they would be paying compared to what they pay now. So hopefully we have that back on the website soon. Um, but really, you know, when you think about it, I guess what I would say is, compare it to a monthly premium, and then remember that all of those additional costs, right? The out of pocket costs, the prescription drugs, the co-pays, deductibles, right? Those are all things that you no longer have to worry about. And I think those tend to be where you see these really high medical bills, um, right? And so it's not just what you pay a month, it's also all of the hidden expenses that go away. Um, but the capital gains tax, for instance, um, again, it exempts the first $15,000 as well as home sales and retirement accounts, right? And what we find is that 90% of Washington State makes less than 10,000 a year in capital gains, right? So really, the vast majority of Washington isn't going to pay anything into the capital gains tax. Same with that payroll tax, right? If you're unemployed, right, you don't make a lot of payroll because you're unemployed, you're not going to pay that tax at all, right? And so really, you know, what we've done is we've attempted to create the most progressive payment structure that we can. Washington State has an unfortunately difficult to work with tax code. And one of the things about it is it requires the taxes effectively to be flat taxes. Um, and so it's difficult to fund something in a way that is progressive. But what we did is by combining several taxes, each of which affects a different group of people, we were able to create a progressive structure overall while maintaining constitutionality and working within the state's tax code.
All right, we have another question for you in the chat from Carolyn. And she's asking, can a business provide health care for their employees through the trust? How does the trust interact with businesses?
Yeah, and basically, businesses would pay into it, and their employees would get covered by it. And so, uh, most businesses, right, would be paying that 10.5% tax. They could choose to deduct 2% of that from employee payroll, or they could choose to cover that 2% as an employment benefit. But their employees are going to be covered, right? So they don't have to do any of the work of administering the plan. Um, and so, really, what we're trying to do is really, really take this off businesses' back and give them a fair contribution to ensuring that every employee in Washington State is covered. And so, in that sense, they can have high confidence that their employees have good health care and are healthy. Employees will maintain their health care even if they change jobs or they're unemployed for a while or go seek an education. And so we'll have a workforce that's much more able to situate itself into a job that is a good match for them, rather than hanging on to something that they don't want to do, maybe that they're not great at doing, but that provides them health care. And so by sort of separating the healthcare from the employer, but still having employees and employers paying into it, we have a system where it's very it's able to be very beneficial to our business community and to our workforce, um, but it's not dependent on it.
Her follow-up is that payroll deduction or paid by the business?
Yeah, and that I'm not 100% sure on the difference, but my understanding is that it's a 10.5% payroll deduction, up to 2% of which can come from employee payroll.
All right. Do we have more questions, comments?
Comment. It is complicated. You can hear me, right? It is complicated, and we need signature gatherers. And so I find for myself, when I don't have all the answers, I remind myself that I'm not trying to get you to vote right now. All I want from you when I'm asking for a signature is to support the process that we have in Washington State, the initiative process, so that people can do their research and make a decision about whether or not they want to vote for it later. I think that for signature gatherers to feel as though we need to have all the answers, it's not necessarily time for that. It will be maybe time for that when we're asking people to vote for it.
Yeah, I appreciate that reminder. It's an important one, and I think that one of the reasons I really encourage people to get out and start gathering signatures is because it honestly can be, in a sense, really underwhelming. I know I felt like I had to know all of the answers, and what I found was that you know maybe about half the time, people are just too busy. They don't necessarily want to stop and talk. The other half, they do want to stop and listen to you. And usually, it just the conversation is about like this. It's would you like to sign to get universal health care on the ballot? And then they say sure. Um, and and so um, most people understand that this is just to get it on the ballot. And one of the reasons I really believe in putting this on the ballot is because of the public conversation that it will generate around it. It can be difficult to get our sort of political system to focus on issues. A lot of the times it focuses a lot on personality. And scandal and that sort of thing. But I think that if we can get this on the ballot, there will be a lot of articles written about it. It'll be talked about on the news and on podcasts. It'll be something that comes up at the dinner table, and we'll all get to have a conversation as a community and as the state of Washington. Like, do we think that we would be better off if we all had health care, or do we think that we're better off in a system in which very very large predatory private industries get to gatekeep our care? And I think that if we have an honest conversation about it, the answer is pretty straightforward. But a lot of the times, the status quo is something that is able to be maintained because we don't talk about it, right? It's not something where we really get into the facts of how our system works. So I think that even if we don't pass the first time, right, or even if it is a contentious conversation, I think that um, getting this on the ballot so that we have that conversation is something that advances this issue forward, and it builds for a future in which we eventually do have healthcare justice. And so I think that every signature, every conversation, every little piece of lit that gets distributed, every tweet or retweet um, builds awareness of the issue, builds the movement just a little bit bigger, makes our message just a little bit stronger. And so I really appreciate as much help as we can get in all of the different ways that folks out there have contributed.
All right. Any final comments or questions? All right. Andre, we definitely want to thank you for coming on and educating us this evening. Sean, you want to give some parting words, as this is kind of your baby?
My baby, it's Joe's baby and my baby. Thanks for coming, Andre, and yeah, we're just trying to not mourn about what's going on in society and organizing Kitsap County, and thanks for contributing to that and educating us tonight. This is what it's all about.
Thank you, everyone. Please stay in touch. Thank you, Sean. And I'm looking forward to see you out on the campaign trail.
Thank you.
All right. That is Andre Stackhouse, Hull, Washington. So again, he gave you all the information where you can get the latest and greatest. And of course, we have Joe and Sean here in Kitsap County to give you that information also. So I am R1 Cameron. This is the Conduit Podcast Network. We